idea of building leadership usually have to go and vote. Unless there's other circumstances.
I don't know.
Are you in Medicare? Is it Medicare?
Did they say what time they're opening the doors?
So you're
They
part
didn't.
of
The meeting starts at 3, right?
We are too. And you know what? Yes. We like
Did they say what capacity they had?
Medicare Advantage. And you know what?
All I know is that
Obama has said, he has said that the way he's going to pay for 2/3 of his
numbered
is by eliminating
At least they
Medicare
were.
Advantage.
At some point. That's okay. I think they
this.
started adding them or something. I'm not sure.
Medicare Advantage is the way that he's going to get money.
No, it's the
to pay
date.
for this whole plan.
Oh.
Whatever.
2/3 of it.
They probably just have
The other
enough
way- the
stickers,
other
and when they run out of
one's gonna be
stickers, that's it.
He was supposed to be. But you check me out. In the same speech in Colorado 2 or 3 weeks ago, in the same speech he said, first he says, if you like the plan you have, use it cheap. And in the same speech he says, but the way we're going to, somebody asked how you're going to pay for it, 2/3 of it, he said, 2/3 of it is going to come from eliminating what he calls waste and mismanagement and things like that in Medicare. Well, what he means is they want to eliminate the Medicare Advantage because that's administered by the private healthcare companies like Kaiser, and he doesn't like it.
And it was very difficult raising a child with diabetes. Our health plan at the time was very good. It covered most of the expenses we had with him. But when he got older and at the age of 23, he had his own job and his own insurance. He was also laid off from his job and lost his health coverage. At that time, we tried to continue the coverage for him, but which was, Kaiser would not allow us to pay for it out of
industrialized nation and with poor results. Today, in a free market system, there are 47 million Americans, and of that, 9 million children who are uninsured. And by 2020, that number will reach 61 million without healthcare.
Can I have that?
Yes, thank you.
Here, and I know this is an issue of deep importance, and if it weren't, there wouldn't be so much deep emotions and the kind of things that we've seen over the past couple of weeks during the August break. We know that this issue of healthcare is bringing our country to a breaking point economically, and our companies are saddled with rising business costs that hamper their competitiveness. Our families are struggling under rising mountains of debt, increasingly unable to afford insurance, and fearful of the consequences of going without. The time for that fear to end is now, and I am confident in the ability of this Congress and the President to move forward together and find a uniquely American solution to one of the most pressing issues of our time. I'm committed to health reform that will improve care, drive down costs, and increase competition and accountability. Right now, more than 47 million Americans do not have health insurance. That's more than 85% of whom are in working families. In the 15th district alone, in this district, there are 77,000 people who do not have health insurance. People who in 2008 cost local healthcare providers over $205 million of uncompensated care. And insurance is becoming even harder and harder to get. And in this district, we have the highest per capita of postgraduate degrees and probably the highest income in the country. And since 1987, the average family health insurance policy has risen from 7% of the median family income to 17%. And in the past year, 53% of American households have cut back on health care due to cost concerns. 19% of all US businesses are planning to stop providing employee health care benefits in the next 3 to 5 years. The loss of health insurance can have catastrophic results. For example, in 2007, 60% of US bankruptcies were due to medical costs. Each year, uninsured patients cost the American taxpayer over $56 billion in uncompensated costs, mostly from emergency room visits. And each year, the broken healthcare system costs us as much as $248 billion in lost productivity, underinsurance, and unpleasant surprises tucked into the fine print of complex private insurance plans means that here in California, more than 2.2 million adults have some medical debt. 2/3 of those people incurred that debt while they were insured. Congress is considering reasonable solutions to bring stability and clarity to the healthcare system while preserving and even expanding competition. But we must act now to solve this problem. We have waited over 6 decades for private insurance companies to self-correct, and now we must act decisively to build a new healthcare system, preserving the best elements of our system while ensuring affordability, accessibility, and guaranteed coverage for all. HR 3200 contains the structure to allow Americans to do just that. Under the bill, insurance companies will no longer be able to impose yearly or lifetime caps on treatment. They will not be able to deny coverage because of a pre-existing condition. Finally, it will be emphasized preventative care will save our system money by catching chronic diseases or cancer early enough to treat effectively and efficiently, not through emergency room visits. The National Health Exchange will promote competition while allowing Americans to see insurance plans side by side, rather like Expedia or Travelocity, which allows you to view travel choices and pick the one that best fits your needs. Private plans will make up the bulk of the exchange, but I support, as does the President and the Speaker of the House, the inclusion of a strong public option for those exchange will allow the American people to come together and purchase insurance at a group rate, the way large employers can. It will be open to any private insurance provider who will offer plans that will meet basic consumer protection standards, including free preventative screenings. And finally, in order to make sure everyone can get coverage, we will provide subsidies to the poorest members of our communities to help them purchase insurance. And we will also provide tax incentives to encourage businesses to cover their employees. And that's the choice between public and or private. So I'm sure that some of you have questions or concerns about certain aspects, but let me just add one more thing in my mind. Healthcare, illness, those kinds of things, viruses and bacteria, they don't choose us by parties or by philosophy. And so I'm hoping that all of us can start to look at and listen to these kinds of discussions in that mind, okay? So I'll listen with courtesy and respect to your views and opinions, and I will only ask that you extend the same to this process and to your neighbors who are here today. So thank you very much, and we shall move on.